My name is Sid Sadler. I am born and raised from Nashville, Tennessee, and I am married to a beautiful wife. We have 2 dogs, and my wife is actually expecting first kid soon, so we're very excited about that. And I was diagnosed less than a year ago. I was diagnosed with stage 2, grade 2 clear cell renal carcinoma. That's the most common type of kidney cancer. And with that, I had a 10.5 centimeter mass on my left kidney. That mass in my left kidney were removed back in February of 2024 by some great doctors at Vanderbilt University. And now I am focusing on advocating in the kidney cancer space. I woke up one morning, it was early December. And December is already kind of a shaky month for me because actually my mother passed away. She was only 57 years old. She passed away December 21st of 2019. And we had her funeral on December 26th, so day after Christmas. Not fun, and you know, it's one of those things where we kind of knew it was coming, but we didn't think it was that fast type of thing. So December's already kind of been a sore month for me and my family. And when I woke up one morning, couldn't urinate, no other symptoms. We thought maybe a kidney stone. We thought maybe UTI, something very benign when you're that young. I was 32 at the time. And I went to the doctor. He ordered a CT scan. And he called me, I want to say he called me about an hour and a half after he got the CT scan, or after I got the CT scan. And he said, hey, can you come to the office? I need to talk to you. And I knew, like, from there, and you know, my wife, she's a nurse practitioner. She's pretty, you know, she's obviously involved in medicine. I could kind of read the writing on the wall. I didn't think it was going to be kidney cancer. I thought maybe something else weird was going on. And got into the office and I saw his nurse. I could already tell it was a little weird because his nurse really didn't spend that much time with me. And that's not a bad thing. I could just tell it was more of a meeting for me and him. And he came in and said, hey, you know, and I have a great relationship with my primary care physician. So I know that it was challenging for him to tell me this. And he said, hey, you know, I looked at your scan. Unfortunately, it looks like you have renal cell carcinoma. So at the time we didn't know like specific diagnosis or anything on the scan. And he said, I'm gonna set you up with a urologist tomorrow so you can take a look at it and figure out where to go from there. And he was like, this is really unfortunate. It's not anything you've done. This is just an out of whack or out of ordinary incident. And my wife was on FaceTime during that because she was working. So luckily she actually works like 2 minutes down the road from my primary care physician. And I went over to her office, and of course, the day that this happened, she slammed because like I said, she's a nurse practitioner, so she's slammed. And I just like sat in her office for probably 2.5 or 3 hours. And I did the thing that you never should do as a newly diagnosed patient. I started going on Google, started going on all these other things. And figuring out like how long do I have to live, and like what are the signs and symptoms, and like what are the causes, and just going down. I dug the deepest rabbit hole you could ever dig. And that feeling, you know, those 4 or 5 hours that day, like, and I know that December 6th, that was the date. I know that it's all ingrained in my mind. And it hasn't even been a year yet. So, you know, we're very hopeful that this December will be turnaround and great, and we're very hopeful for that. But that feeling, and I've told many people this, I've never, like when people say it's the worst day of their lives, yeah, it doesn't matter how big the tumor is, what type of, like cancer in general, getting those words it's a very lonely feeling, very humbling feeling. So particularly for YAs or young adults, that's kind of the space that I'm in. When you think about cancer, I think generally people think it affects folks that are maybe a little bit older than myself. I'm 33, so very, very young for kidney cancer. Regardless of the type of cancer, it can be kind of a shock. You're kind of in like a fog of war type of scenario, because you're kind of right in the middle of your life. You're For my wife and myself, we had just started talking about starting a family. So with that, you don't necessarily run into those things if you're a little bit older. You've kind of already established your family or established kind of what you're doing. For myself, I had just started my professional work in the line of work that I was in, and my wife and I had just started talking about starting a family. So I think that's one of the biggest unique characteristics of being a young adult diagnosed with kidney cancer. So if you've just been diagnosed with RCC, I think one of the most important things to do is to get involved with an organization like the KCA. And getting involved doesn't mean just advocating or going out to events and doing things, just reaching out to them and seeing if they can be of assistance to you. Perfect example, and just the other day I referred a patient to their website because they have a just diagnosed toolkit. So you open this thing up, it tells you exactly what to do, where to go, who to see. A really important aspect of this cancer specifically is since it's rarer than other cancers, it's important to see an oncologist that specializes in kidney cancer if you're able to. It's a whole nother different conversation depending on how far away they are from you and that type of stuff. But if there is one close to you, you would be able to see that on the website through that toolkit. And just getting to a specialist that sees a lot of kidney cancer is vital. The second piece of advice I would give is if you're already, depending on how comfortable you are in the advocacy space and after you've either had your surgery or you're in current treatment, getting involved with other patients, whether it's through advocacy work like a big event or even just getting involved in a support group, whether it's on Facebook or somewhere local, is vital, I think. Especially if you're on the younger side, there aren't as many patients that are my age that are in the kidney cancer sphere. So I think that that's very valuable because you can then talk to other people that are going through the same things you're going through. So with stress and anxiety, I see a therapist. I was seeing a therapist before my cancer diagnosis. And I've kept the same therapist that I've had. And one of the things we talk about, and obviously it's patient to patient, not everything that works for me is going to work for everybody, but realizing that it's not a stress or an anxiety that's going to just disappear or go away overnight. It's something that you first have to accept, and you kind of go through the stages of grief. You kind of accept it, you go through treatment or you go through surgery. And like I had said previously, getting involved in those support groups or advocacy work is, I think, paramount to being able to handle that stress. It's not necessarily the, oh, misery loves company type of thing, but getting involved with other folks, especially that are around your age, like myself, I'm 33, so being able to talk to other patients that are around my age or even a little bit younger or older, I think is extremely valuable to helping with that stress and anxiety. It's something that at first when you're diagnosed, it kind of hits you like a train. That first week or two, definitely probably the most tough. But as you see your doctor, as you get treatment or as you get surgery, that stress kind of chips away. And it's kind of up to you to navigate that after the fact and mitigate that stress and anxiety that comes about. So social media is really tricky. I think it's gotten a bad rap, and I think deservingly so in certain instances. But I think particularly with cancer, I was already involved in social media and communications before my cancer diagnosis. So I think for me, it came a little bit more naturally than maybe some other people post-diagnosis. But for me particularly, being able to connect with other patients that are closer to my age. I'm in the millennial group. So after diagnosis, I definitely was on, Facebook, Instagram, TikTok, typing in, kidney cancer or kidney cancer treatment or young adult kidney cancer. And that allowed me to connect with other people that were near my age, or even if they're not near my age, connect with other patients that are going through something that is very similar to what I was going through. So there are valid arguments that social media can be maybe a toxic place, and I think that that's very valid and true. But I think the good, especially for kidney or for cancer patients in general, but we're talking about kidney cancer specifically, it can be very helpful, whether it's through a Facebook group or whether it's through connecting with a doctor that you maybe wouldn't have known about, or finding out about a treatment that you wouldn't have known about. It can be very helpful for a cancer patient. Specifically talking about like how I view myself in this advocacy role with the KCA, for me, I've tried to put myself back in that position that I was in the first week or two that I was diagnosed, and I would never wish that feeling on anybody ever. Doesn't matter how much you've offended me, and I think that I want to be able to ensure that those patients feel just a little bit better. We're not going to make people feel 100% better when they're diagnosed with cancer. That word carries so much weight with it that you're never going to be able to battle against that, but you can soften the blow. You can give people resources. You can let people know that treatments have come extremely far, even in the last 7 to 10 years. I think that that's the role I kind of want to be put in. Just the other day, I talked to somebody who they were 35 or 36, a little bit older than me. And it's a blow because most people our age, they're, you know, oh, I've never smoked, I've never drank, I'm fairly active. Like, they might have one thing that could contribute to kidney cancer. We don't really know, you know, what's overall contributing to that, but it comes as a blow. It just kind of interrupts your life. So being able to be there for people when that happens is kind of where I view myself. There was a patient that reached out to me that he was a little bit older than me, but still very young for kidney cancer. And he lived up in Boston. It was definitely far away from Nashville where I was living at, but he saw one of my videos online. I don't know what video it was, but he saw one of my videos online. He just messaged me out of the blue. He was like, hey, yesterday I found out I probably have kidney cancer. I'm freaking out. I have, you know, a kid and this and that and everything. And I was just like, yeah, I understand that. Like, I feel that. And being able to connect with those people and kind of soften that blow, like I talked about earlier, that is what makes those things worth it. Because that feeling is so, even if you have friends and family, let's say you have the best support system ever, it doesn't do anything to hearing you have cancer, let alone a large tumor that we have no clue what's going on, and that you're 32 years old, and it's just pretty rare. Like, when doctors start kind of raising their eyebrow a little bit, that's when you start to get a little worried. So lessening that blow of that diagnosis or hearing that you have kidney cancer, that's what I want to do. That's what I'm aiming to do. There are plenty of other advocates out there that are in, and that's the beauty of advocacy work. It brings in people with their own skills and their own leverage that they can bring to it. I have a background in communications and social media. That's where I want to focus on. But somebody might not have that background, and that's perfectly fine. You can still fit into a place within the organization. The KCA, they are adamant about being involved and active with their advocates, especially when I was diagnosed and after I was looking to get involved with the KCA. They very much it was reciprocal. They very much wanted to work with me and reach out to me about different events and different ways I can get plugged in. There was never really a time where I felt like I couldn't get involved with something the KCA was doing. If there was a spot and it made sense, they definitely reached out to me and allowed me to get involved. And that was valuable because when you're after a diagnosis and I'm already, you know, I have a whole nother life, right? I work, we're expecting a kid. I don't necessarily have time to keep up with like every single thing. So they have been very, very great. The KCA has been very great about reaching out to me in ways to get involved. When I mentioned that I was interested in advocacy work, it was the first conversation I had really had with that person who got me plugged in to the KCA. It was never like, hey, you should go do this, or hey, you should go do that. It was very natural, and I think that's very important. I don't think anybody should be like just forced or thrown into it. I think when you're shown that interest in advocacy work, and like I said, when I reached out to the KCA, they were very reciprocal with wanting to be involved and finding out not only more about my story, but finding out ways in which I can help other patients tell their story. When I look at where I was a year ago, I was already very proud of the work I was doing just in my civilian or private life and in my professional work. But when I look at just the impact I've been able to make in the last I would say 6 or 7 months with the KCA doing advocacy work, I feel very proud. It's sometimes it feels like a fever dream after a diagnosis like that, and then now I'm talking in front of people about this, and it's been less than a year, but I'm definitely very proud. Kidney cancer is on the rare side of things, and with kidney cancer, something like 80,000 people will be diagnosed each year with kidney cancer, and that's a large number, even though it's on the rare side of cancer. So the best way to find out information and going about, whether it's through advocacy work that you want to get involved in or just information in general, is to find these organizations like the KCA. And you don't have to get involved necessarily with advocacy work right off the bat. You could be looking for information, whether it's a second opinion or learning about the disease. Social media and Google can sometimes be your worst enemy when it comes to cancer, because you will Google and you will find things that are backwards looking or backwards facing. You're not looking at what's forward facing. Those numbers aren't out, those studies aren't out. When you look at getting involved with an organization like the KCA, you're able to get that up-to-date information. And one of the reasons why is because they partner with physicians, doctors, researchers that are at the cutting edge of this disease. We're not Google. We're not looking backwards, we're looking forward. So that's been very powerful, for me, but it's definitely going to help other patients too.